Today for Julie we're going to treat her facial redness. The cause of her redness is rosacea, and you can see she's got some redness coming through in the cheeks on both sides and a little bit in the nose as well. Often redness tends to affect the chin and sometimes in the forehead, so this sort of central part of the face. Really common issue, can be lots of different causes for it, but the way that we like treating it here in the clinic is using a technology called IPL, or intense pulse light. And the way that that works is by shining a really bright light into the skin, which reacts with pigments, and there's a couple of different pigments that it's good at picking up. One is anything that's red and the other thing is anything that's brown. So any red patches in the skin are good at reacting with the light, which generates heat. That heat then causes the blood vessels to coagulate, so it causes the blood vessels to shut down, and that helps to diminish the redness. Treatment takes just a few minutes to do the whole face. We normally recommend anywhere between 4 and 6 sessions, just according to how bad the redness is, exactly what it is we're treating. And sometimes if there's some pigmentation, there's a few little patches of that, we can treat that at the same time. So it's a really nice treatment for just improving the overall quality of the skin, especially anything related to colour. So anything that's red or brown, IPL is our go-to technology. So I'm going to hand over to Deborah, who is our laser therapist, who does all of our IPL treatments in the clinic. And Deborah will take care of you. When we're treating vascular changes, we can either use laser or IPL. We tend to use IPL much more frequently than laser for doing this. And the reason for that is that often the laser can cause some bruising that can be quite obvious and take a few days for it to disappear, whereas with IPL we can do this with virtually no downtime whatsoever. So there'll be a little bit of redness afterwards, but that's going to die down within an hour or two at the most usually. So this is the sort of treatment you can have done and go back to your normal activities pretty much straight away without any major inconvenience. There is a little bit of discomfort as the machine fires against the skin. You do feel a burst of heat. It can be quite uncomfortable, but it's short-lived. As soon as that flash is, as long as the pain will last. So it's not like a lingering pain where you're in discomfort afterwards. It's as soon as the zap hits, you feel a short, sharp burst of pain, and then it's over with. We've got different sized tips that we use according to the area. So in a big area like the forehead, we're using one of the bigger ones. But when we get in around about the corners of the nose, for example, we'll use a slightly smaller tip so that we can get in and be a little bit more targeted in delivering the energy. Again, we normally leave about a month in between treatments, and most patients will have a course of between 4 and 6 treatments, just really depending on how extensive the vascular changes are and what we need to do. One of the most important things here is that when you come for treatment, you mustn't have any tan in your skin. So no real tan and no fake tan. If you have tanned your skin, or if you've been on holiday, you should give it at least 6 weeks for the tan to fade before coming in for your treatment. Before we begin a course of treatment, we do an initial test patch just to make sure that your skin doesn't have any abnormal or unexpected reactions to the treatment. And after the test patch has been done, we usually leave it about a week or so before we begin the course of treatment.